All right, let's dive right in. Today, we're talking about a very real and very confusing mental tug-of-war, what it's like when your brain has both ADHD and OCD. It's a world packed with contradictions, where you can feel totally scattered one minute and then intensely, painfully stuck the next. Have you ever asked yourself this, genuinely? If you've ever felt that chaotic push of impulsivity, and then, moments later, the paralyzing pull of doubt and obsession, well, this explainer is for you. We are going to untangle this complicated and honestly really misunderstood experience. So here's our roadmap. First, we'll talk about that confusing overlap. Then, we're going to break down ADHD and OCD separately. After that, we'll get to a huge aha moment about where they pull your focus. And we'll wrap up with an actual, actionable toolkit you can use to manage both.
Okay, first up, let's just validate the feeling. If it feels like a paradox, that's because it kind of is. It's not just in your head. There are real, clinical reasons why these two conditions feel so at odds with each other, even while they share symptoms that can make getting a clear picture really, really tricky.
So look at this. On the surface, the symptoms can look identical. Difficulty with attention, trouble finishing things, feeling restless. Check, check, check for both. But, and this is the whole point, the reason for the symptom is completely different. Someone with ADHD might not finish a project because, a new shiny idea pops into their head. But someone with OCD might not finish that same project because they're stuck obsessing over getting one word, one sentence absolutely perfect. Same behavior, totally different engine driving it.
And here's the thing. You are not alone in this. It's actually really common for neurodevelopmental conditions to show up together. This stat, for example, is about the overlap between ADHD and autism. The exact same principle applies to OCD. Having one condition simply makes it more likely that you might have another. So, if this is your reality, just know it's a well-documented one.
Okay, so let's zoom in on ADHD for a minute. Forget the stereotypes of just being hyper. The real core challenge of ADHD is something called executive dysfunction. Think of it as a struggle with the brain's own project manager. This is so important to understand. ADHD isn't a character flaw. It's not a lack of willpower or laziness. It is a neurodevelopmental disorder that literally impacts the brain's ability to organize, to prioritize, and to execute tasks, especially when there isn't some immediate, exciting reward. It's a genuine struggle to plan for the future. And when you look at these common symptoms for adults, you see they all connect right back to that executive dysfunction. The trouble with prioritizing, the poor follow-through. It's not a choice. It reflects a brain that is fundamentally wired for novelty, which makes it incredibly difficult to stay focused on something kind of boring that only pays off way down the line. Now let's pivot. Let's look at the other side of this coin, obsessive-compulsive disorder. With OCD, the struggle isn't a brain that's constantly seeking out new things. It's a mind that gets trapped, completely stuck, in a painful repeating loop of unwanted, intrusive thoughts. Okay, this right here, this is the absolute key. Everybody, and I mean everybody, has weird, random, intrusive thoughts. The difference with OCD is that the mind is, well, it's sticky. The thought gets stuck, and the very act of trying to push it away is what pours gasoline on the fire. That resistance is what tricks your brain into believing the thought is not only important, but dangerous. And the really cruel twist with OCD is that the obsessions often attack the things you value most. A deeply loving parent might have terrifying thoughts about harming their child. A deeply religious person might have blasphemous thoughts. This creates this crushing sense of guilt, and that guilt drives the desperate need to perform compulsions just to get a moment of relief and feel certain again. So all of this brings us to the real turning point in this whole conversation. We've seen just how different the internal worlds of ADHD and OCD are. This next idea is a really simple but incredibly powerful way to frame that difference. For a lot of people, this is the real aha moment. Here it is. This is the simplest way to think about it. OCD is an internal storm. It violently pulls your attention inward into a hurricane of thoughts, feelings, and urges. ADHD, on the other hand, pulls your attention outward to every single sight, sound, and new idea in your environment. One feels like a prison inside your own mind. The other feels like the world is constantly screaming for your attention. Okay, so with that clarity, what do? Now we can start building our toolkit. We need concrete, practical skills to manage both the internal chaos of OCD and that external disorganization that comes with ADHD. First up, to deal with that powerful inward pull of OCD, we're going to grab a core skill from cognitive behavioral therapy, or CBT.
The goal here isn't to stop the thoughts. You can't. It's to fundamentally change your relationship with them.
This is a tool called a thought record, and it's basically a structured way to become a detective of your own mind. You start with the situation, write down the automatic thought that popped up, identify the emotion it caused, and then, this is the magic step, you identify the thinking error. From there, you can build a more balanced, rational response. It helps you untangle yourself from the thought.
All right, next, for that outward pull of ADHD, we have to stop trying to muscle through with willpower. It just doesn't work long term. The real key is to become an architect of your environment, to design better systems.
This framework comes from the fantastic book Atomic Habits, and it's built on these 4 laws of behavior change. To build a good habit, you make the cue obvious, the craving attractive, the action super easy, and the reward satisfying. For example, if you want to remember your medication, put the bottle right next to your toothbrush. The cue is now impossible to miss. It's all about making good habits the path of least resistance.
And finally, we need a tool that works on a purely physical level. Both ADHD and OCD can crank up anxiety, restlessness, and just straight-up tension in your body. This skill is a way to intervene directly and tell your nervous system to calm down.
This is called progressive muscle relaxation, or PMR, and it is a surprisingly powerful tool. You just systematically tense up a muscle group, like making a fist really tight for 10 seconds, and then you let it go completely. By doing this over and over, you're literally teaching your body the difference between tension and relaxation, giving you a direct, physical way to dial down that anxiety.
But you know, all these tools, all these strategies, they have to be built on a foundation of self-compassion. As Dr. Christine Neff puts it here, your worth comes from just being human, not from perfectly executing some ideal. When you can believe that, you can use these tools as acts of self-care, not as punishments for a broken brain. And I really want to leave you with this final thought. What if this whole journey, the confusion, the diagnosis, learning all these skills, what if it's not about fixing your brain to fit into some neurotypical box? What if the real goal is to finally become a fluent interpreter of your own mind, to learn the unique language it speaks, and to discover the very specific things it needs, not just to get by, but to actually thrive?